Hello, everyone, and welcome to Wellness Wednesday, presented by the University of Arizona Health Sciences. I'm Caroline Berger, Director of Corporate and Community Relations for the University of Arizona Health Sciences in Phoenix. And I'd like to introduce you to our fabulous new team, led by Allison Autu, our Executive Director, Anne Marie Medina, who is Director of Corporate and Community Relations for Health Sciences at our Tucson campus. Thank you for joining us today and sharing this lunchtime respite with you. For those of you who are not familiar with us, the University of Health Sciences is the statewide leader in biomedical research and health professions training. Health Sciences includes the two colleges of medicine based in Tucson and also in Phoenix, the College of Nursing, Pharmacy, and the Mel and Enid Zuckerman College of Public Health. We have main campuses, locations in Tucson, and the growing Phoenix Biomedical Campus in downtown Phoenix. As you can imagine, Health Sciences reaches across the state of Arizona and the greater Southwest to provide cutting-edge health education, research, and community outreach. And perhaps you've seen and heard a lot about us in the news lately. We've been doing some really remarkable things. We are also a major economic engine. Health Sciences employs nearly 5,000 people, has approximately 4,000 students, and 900 faculty members. And we're very proud to say that each year we earn close to $200 million in research grants and contracts annually. Our leader is Dr. Michael Dake, who is the Senior Vice President for Health Sciences. We invite you to join us and share more information about us and learn more about us at uahs.arizona.edu. And I invite you to follow me, CE Berger, on the Twitter account. And be sure to do a hashtag with Wellness Wednesdays Arizona. We want to be able to spread the news to everyone that's out there. Today, you're going to have a chance to chat with us. So please leave a question in the chat box as we go along. And we will also have a post-session email will be sent to you either later today or tomorrow, which will include a very brief survey and also links to the resources and recommendations that you see today, and also a recording of today's presentation that you can be sure to pass along to family and friends. I also want to point out that in this time, these ever-challenging times, that the University of Arizona, the Mel and Enid Zuckerman College of Public Health, has some help and resources out there for teens and parents. How do I get through this? A guide for parents and teens during COVID-19. You can find this information and videos at publichealth.arizona.edu. So please be sure, if you're like myself and am home with a teenager, this could be very useful for you. And don't worry, we will include this resource in our post email after today's session. Now, it is my honor to introduce today's presenter, Dr. Lori Martin-Plank. Dr. Martin-Plank is a family and gerontology nurse practitioner who today is going to discuss a variety of ways that you can engage all members of your family, all generations, and find out more about your family tree. Dr. Martin-Plank teaches remotely in the University of Arizona Doctor of Nursing Practice program. Her clinical practice has spanned many decades and includes family practice, mobile health, hospice health calls, and long-term care. She has presented nationally and internationally on topics related to older adult health. She is passionate about supporting older adult wellness and aging in place. And today, it is my honor to introduce to you, live from Pennsylvania, Dr. Lori Martin-Plank.
Thank you very much for that introduction, Caroline. And I'm very happy to be here, and I'm really excited to be talking about this topic, which is very dear to my heart. So I want to start out with, do you remember when? And what you'll see here is a picture of a family. And this is actually my family in Ireland. I have an international family. Half of us are in the States and half are still in Ireland. And if you looked at that picture, it would look to you like just a perfect family with the grandmother, the mother and father, and the sister and a newborn. In actuality, it's an international picture. The little baby is adopted from the United States to his Irish family. This is his godparents and his cousin who are there. So you wouldn't know that looking at the picture. And I think that's one of the points I want to make today. it's really important to connect with people. For a long time, families were all together and, it was very easy to connect. I would say in the last 30 years, that changed a lot in the United States with mobility due to jobs and leisure. The family is not often located in a central area, but they're more scattered all over, either within the states or internationally, as mine is. So how do we keep in touch? And particularly in the era of COVID, how do we keep in touch with our older family members? And I just want to share with you a little bit from my experience working in the nursing home, what it's like now. The nursing home is home to many older adults. It is their home. They welcome their family coming to visit them. They enjoy visiting with other people in the nursing home, and they enjoy the activities. Right now, all of that is stopped because of COVID. They're confined to their rooms, they're socially isolated, and the only people that they see are the ones who are bringing in a meal tray or taking care of them. So it's really important to try and reach out to them virtually to stay in touch. And even if you have an older adult who is healthy and well and is not in a nursing home, the chances are that they are much more socially isolated than usual. Certainly they can pick up the phone to talk to you, but if they don't have access to technology, it's very difficult time for them. And the other thing is, it's so important to listen to what older people have to share with you, older family members. I think many of us in our busy lives don't take the time to do that until perhaps it's too late. They might have experienced a cognitive problem where they can't remember, or they've passed on, and you're losing part of your family heritage. So I hope that you'll consider what we're doing in terms of sharing today. Next slide, please. Okay, so right now there are many technology apps that we can use to stay connected. Just going to go over them briefly. I am not a techno wizard, but I have used some of these. Facebook Messenger, if you are on Facebook, and many people are, and even if you're not on Facebook, there are ways that you can connect, because many older people are not on Facebook. You can download this app and you can actually talk to people and see them, and it's free. Skype is another methodology. I'm most familiar with using that on my laptop. You set up a free account and you can see people and talk to them. Zoom, which we're using now, is relatively new, but it's grown by leaps and bounds. And it's very easy for older people to use. You just send them the link and they click on it, and it will download the program and open up for them. So it's very easy for you to chat with them. FaceTime, if you have an iPhone and your family member has an iPhone, is another way to stay in touch. And that's an easy thing to do. You just hit the FaceTime button. Google Hangouts are similar to that. Marco Polo is an app for Androids. And I don't have an Android, but I looked it up, and it's billed as an app that families want to use to stay in touch. It is free. You can also subscribe to it for special things. I think if it's free, it doesn't archive your conversation after a while. WhatsApp is another app that you can use to stay in touch by chatting and by visual. Finally, if you have a family member who lives in China, Google is prohibited in China. So the way to stay in touch with them is an app called WeChat. Okay, next slide. Let's see. So how are you going to do this? You know, lots of times, first of all, you're not thinking of things, but other times it seems awkward and you may not know how to start the conversation. So this is a picture of some older people that I worked with actually when I was a nurse practitioner in Philadelphia. And they are Puerto Rican, and we refer to them as abuelas, which are grandmothers, because they are in fact all grandmothers. We also refer to them as wise women, because in the area of North Philadelphia where they live, they were the wise women of the area, and they had a great influence on families, their families and other families living there. So how would you start a conversation? Oops, I think.
Oops, sorry.
That's okay. What you can do is, like, say, I found this picture when I was cleaning out some boxes. And isn't that usually what happens? And you kind of wonder where it was coming from. So, you know, who are those other senoras with you? That would be an easy way to start it. Where are you and what are you doing? That would be another way to start it. And finally, what year was this? And I want to emphasize another point about pictures. I don't know about you, but I inherited a box of pictures with no notes on the back of them. So I had no idea who some of these people were. I knew they were my family. Some of them were family from Ireland, but I didn't know who they were, and I didn't know when the pictures were taken. So when you find a picture, make sure that you make a note on the back of it, who the people are and what year it was taken. And certainly if you're technology oriented, you can digitize the picture and save it that way. But even if you're not, writing on the back of it will help you and your children, you know, your siblings, anybody who wants to know more about it. Next slide. Okay. Oh, there you go. Another area that I think is really important as a nurse practitioner in connecting with your family through the generations is preserving your heritage and really enhancing your family health. I think we're very fortunate that one of the former Surgeon Generals came up with a program called the Family Medical History Program, and you can do that. And it's very easy to use. There are also other family programs that are not medically oriented that are, you know, for you to stay in touch with your family and to kind of do a generational tree. The most well-known of those is Ancestry. And it is something that you need to subscribe to, but it's a very credible program. And you may actually make connections with other people in your family through that. Another one that is, I believe, still free is called Family Tree Maker. And that's how I started out connecting with my family. So let's move to the next slide here. So this is a picture from the Centers for Disease Control and Prevention of my family health portrait. And it's very easy to see. As a matter of fact, some of you may be familiar with it because a lot of organizations, a lot of health insurance companies have adopted this. And some of them even have put it into the medical record. But what you can do is you can enter your family health history and you can learn about your risk for conditions that run in families. And then you can print it out and you can share it with your healthcare provider and save it and add to it as you learn more. Then you can also pass it on to your children so that they know about the family health history, because just like the history of the family in general is often lost. The health history is certainly lost as well. And it can be very important to have that information. So I'm just sharing that with you, and I have a link to the website on the former slide. Next slide. So finally, I just want to share a timely piece from social media. And this was sent to me by Caroline, who is, running this program. And I just thought it was really great. It was from Holly Branson, who is related to the Bransons of Virgin Airlines. And it's a link to a letter that she wrote to her grandmother, really, saying how wonderful her grandmother was, how important she was in the family and things like that. And to me, that really illustrates the point, that I'm trying to make, that it's so important to keep in touch with other generations in your family, particularly in the time of COVID. Thank you very much. I'll be happy to answer any questions.
We do have one that says, if you are saving photos digitally, do you recommend a specific program that allows you to save notes that you would normally write on the back of the photo?
I think that's a great question. So I actually consulted with our videographer at the university, because that's, I'm not an expert in that area. And what he told me is, whatever you're doing, do it at least in 2 areas. In other words, there are cloud-based programs such as Box that you can save photos in, and you can even save videos in. And videos from Zoom can be transferred to a more permanent platform like Vimeo or QuickTime, so that you can save them, because sometimes when they're recorded, they disappear after a while. But there are permanent platforms. Now, the photos, he recommended something called Smug Mug for the photos. And he also recommended backing up everything that you do on a hard drive. So they are the tips that I have from the expert on that. Thank you for asking.
Very good. And if you're like me, always remember to download from your phone, because I have a tendency to forget to do that and take some incredible pictures and then do not download them after that. A few more questions that are coming in. Do you have some suggestions on weaving children in this process?
Yes, and actually the whole idea for this came to me years ago from my husband, who was a school teacher. And he taught middle school. He actually had the students do a project on their family history, where they were assigned to talk to a grandparent and to do a poster on it. And I am telling you, it was the most successful program of the year. They had the open house and the families came and they had their posters and everything like that. So that was done on a middle school level. But you could certainly do it on an individual level. And I think any occasion where a family, different generations are present, is a time to do that. That's a great time to do that. We used to do things at Thanksgiving and Christmas, storytelling and things like that. For small children, it's really amazing what they absorb. And I'm just going to share from my family history. My mother had several illnesses, and she was in an assisted living facility, and she was on oxygen. My daughter was in 4th grade, and the teacher called me up to tell me about the story that my daughter wrote about my mother, and how she had drawn a picture of her with her portable oxygen and everything, about going to the nursing home, playing bingo with the people there, and visiting with grandma. So I think children are really great as far as absorbing family stories. Another story in my family, my my aunt, my mother's sister, married my father-in-law. So my daughter used to tell the stories about how she had two grandmas that were sisters. And children just love those kinds of things. So if you know, offer them the opportunity, they will definitely participate in it. And it will really enhance their relationship with older family members too.
Yes, and I remember with my young daughters growing up, one of the assignments they had was to videotape and interview my father. And we still have that today. And it's absolutely amazing the information that he shared that we did not know. He had served in World War II. And he sat with her and told her these stories, and we would have never gotten that information. And it's such an important thing and be able to share with generations, not only today, but to come. A couple more questions. What health questions should I ask my parents?
That's a great question. I think that you would want to know if there's any history of cancer in the family. Do they remember if their parents, or primarily their parents or their grandparents, had any kind of cancer in the family, or heart disease, diabetes, or stroke? I think they're kind of like touching the big ones, okay, that run in family. High blood pressure, which usually precedes a stroke, you know. And some of them will be able to tell you and others won't, but anything is better than nothing, you know. So I think that they would be the questions.
Okay, we're getting a few questions in related to sending letters now during COVID. And what are your thoughts? Should now be the time to send a letter to your loved one that's out there, particularly if they're older, or should we look at other ways to communicate? How do you feel? Do you feel it's safe to do so, the written word?
I think anything that you do is going to help with the social isolation. You know, if they can't read because they have visual problems, I would just send a card. You know, like there are a lot of cards. If you give a donation to organizations, they send you these beautiful cards. You could just send one that says thinking of you and write a little note in there, or, you know, just sign your name to it so they know that you're thinking of them. Writing letters, I think if they are cognitively intact and can read, or have someone who can read to them, are wonderful. Other ways of staying in touch, if the facility is willing to cooperate with you, you might be able to FaceTime on an employee's cell phone. I know even people who were in the hospital with COVID were doing that through the nurses. Or you might be able to use an iPad. And I know I saw some facilities actually had a little van. They were taking people out and they had Zoom on the van and they could contact their family members. So I would just say be creative about it. But the important thing is to reach out and keep in touch, because you're doing things at home, but for frail older adults, they're really just sitting there in front of a television probably. And any contact would be appreciated.
And I know many are following CDC guidelines, and if you do send a letter or postcard or something, they are holding them for 30 days, but then they will distribute them after the waiting period also as well. Another question, I am a first generation immigrant. Are these programs like Ancestry applicable to my situation?
I would say yes, they are. It's not just a national program. It's an international program. And there are databases from all over the world that go into it, you know. So I would think that if you're searching for people in the country that you came from, if there are still people back there, you could find them, or you might be able to find people who know about them, you know, that you could keep in touch with. Yes. Yeah.
Okay.
Yeah. Go ahead.
Go ahead. I didn't want to interrupt you.
So when my husband actually did my family genealogy, and he actually found the boat that my grandfather came over from Ireland on when he was a little boy. And he found it because there were 4 brothers and their parents. And he found the name of the youngest brother. And then he found the others. It was on a different page. So he had to go back. But he found, so then we knew the date that they came from Ireland to the United States and where they landed and everything like that and who was on board. So yes, all that was in Ancestry. And a lot of the churches have put their records in there now as well. So you can find marriages and things like that on there. Yes. Mm-hmm.
Wonderful. And I also just received notice, and very timely, that University of Arizona Life and Work Connections will be sharing intergenerational activity ideas this coming Friday at 10 a.m. Mountain Standard Time. So we will be sure to include that resource when we send out our email, our post email following this today. So we will go ahead and conclude our question and answer session right now and continue on. And speaking of continuing on, thank you, Dr. Martin Plank. We appreciate this. And I know that this means a lot. And I think the main theme for today is please do this while you can, because you just never know. We look forward to next week, June already, for Wellness Wednesday, where we're going to present the science of ergonomics, creating healthy bodies for productive minds. So I know that many of you may be working from home, so you may find that your office situation is a little different than what you're used to. You may be, your desk may be makeshift of some boxes, or I've seen all kinds of interesting contraptions that are being used out there to function. So be sure to join us next week with Charity Madrid-Torres, who is risk management specialist at the University of Arizona. This is going to be very informative. And then I want to thank you for joining us today and spending this half hour with us on behalf of my colleagues, Allison O'Toole and Marie Medina. We hope you stay safe, we hope you stay well, and we hope to see you next week. Thank you.